A very good evening, everyone. I'm Sahil Srivastav, currently studying at UCMS Bhairava, and today we are going to discuss like one of the very major topic of the upper limb. Sequentially, when you are studying the upper limb, the first topic that you should study is actually the brachial plexus only. Okay, so we are going to like study is a bit complicated topic, but we will finish it somehow. So this is the first part, and I will probably discuss um, the major lesions or like the paralysis that happens due to the lesions in the brachial plexus in the second video itself. So first we are going to like study about the brachial plexus. So there's a brief introduction about it. So the brachial plexus, the nerves of the brachial plexus actually originates from the C5 to T1. Okay, sorry, C5 to T1, C5, C6, C7, C8, and T1. These are actually the spinal nerve roots from where the brachial plexus originates. So there are actually 5 anatomical sites that are well demarcated in the brachial plexus. That is the first is the root, second is the trunk, division, cord, and branches. So there's a like very good mnemonic about it. I use like this mnemonic for myself: real Texans drink cold beer, where R stands for roots, T for trunks, D for division, C for cords, and B for branches. So while we are studying the brachial plexus, we are moving actually medially to laterally, medially to laterally, like from the posterior triangle of your neck to the arm. So now we are going to make a small diagram here. I would like you all to follow it. Like I would like you all to just make it down. It may help you all. So the first would be the from C5 and C6. They both converge and form the upper trunk or the superior trunk. Okay. So, okay. They converge and form the superior trunk. Let me write it down here. Superior or the upper. And the C8 and T1 will converge and form the inferior or the lower trunk. And C7 will continue alone and will give the middle trunk. Sorry for the I'm writing here. I'll just make it look aesthetically good. Okay, so it will be going to give the middle trunk. So now the division, like all these trunk will actually divide it into two parts, the anterior and the posterior, two division actually. So let me make anterior division with the orange color, the anterior division, and the posterior division with another color, so you can differentiate it. Okay, let's make the posterior division with the brown one. Now I would like you to focus. This is the posterior one, and this we reduced the orange. Okay, this is the anterior division. So again, let me tell you all something that is relevant here. Okay, that is relevant here. There will be three cords: the lateral, the posterior, and the medial. So what are these actually like named after? Why are these named lateral, posterior, and medial? So there's an artery that will go around your hand, that is the axillary artery, and it is actually, when we study anatomy, we will divide axillary artery into three parts: the first part, second part, and the third part. But the second part of axillary artery will actually be differentiating these cords into the lateral, posterior, and medial. So imagine if this is the axillary artery, one cord will be passing lateral to it, one medial, and one actually posterior to it. So that's how you actually give the name of the cords. So now what we will do is we will again change the color, probably to make it look good, because my handwriting isn't that good. Okay, so the anterior division of the superior and the medial trunk will converge. Okay, just follow me here, don't like lose it. It is probably the most complicated part here. Okay, and these will form the lateral cord, and then the posterior branches of all the three trunk. See, the posterior branch of the superior trunk, the posterior branch of the middle trunk, and the posterior branch of the inferior trunk will converge and form the posterior cord. So I guess it is easy for you to remember because all the posterior divisions, like all the posterior divisions of the superior, middle, and inferior trunk are going to converge and form the posterior cord. And lastly, the anterior branch of the anterior division of the inferior trunk will go as it is to form the medial cord. So that would be like all for the chords, and now we will move towards the branches. And let me tell you guys, the branches name would be easy if you follow some mnemonic or something. So let me just write it somewhere else, I guess, because there are a lot of branches. So first let me make lateral cord will actually give 3 branches, posterior cord will give 5. I will tell you the major ones and the minor ones, okay, both, but the major ones are the one that you have to focus a bit more, okay. And the middle cord will give also 5 branches. So let me write it here only. The first would be the for the lateral cord you should follow the at the rate LML. The first would be L M L. For from the first L you should know that it is the lateral pectoral nerve. Lateral pectoral nerve. And from the M, that is one of the very major nerve of your body, that is musculocutaneous nerve. Musculocutaneous. And another L will be the lateral root of the median nerve. Okay, so let me write it somewhere else because I don't think it is good enough, like the place is sufficient enough. So yeah, let me write it somewhere else. Okay, so the lateral cord will give 3 branches, 1, 2 and the 3. The first one would be the lateral pectoral nerve. Lateral pectoral nerve. The second one would be the musculocutaneous. I hope you are writing with me because unless or until you are going to write it by yourself, see, there is something known as the muscle memory of the hand, so it might help you remembering somewhere in your exam. Okay, so these are the 3 branches of the lateral cord of the brachial plexus. And then we will go, and so for it you have to just remember this mnemonic at the rate LML. L for lateral pectoral nerve, M for musculocutaneous. See, I would like to give a big star here because this is probably the most important nerve of your forearm that is going to supply the anterior compartment or the flexor compartment of your arm, which has the BBC muscle. BBC muscle, brachialis, biceps brachii, and the coracobrachialis. So now we will go and we will know about the medial cord. Oh sorry, let's just move at the posterior cord only. Posterior cord. Why posterior cord? Because it is the most important cord. You have actually 2 or 3 nerves here. So for this you have to just remember ulnar. Ulnar. Maybe you shouldn't use this mnemonic because you know the ulnar nerve is going to get featured in the medial cord only. And if you are going to use the ulnar mnemonic, you will get confused and you will think that the ulnar nerve lies in the posterior cord. So better use the lunar mnemonic. So there are actually, I have already told you, there are actually 5 branches. I would like to first write the lunar. Don't remember as ulnar because the ulnar nerve is in the medial cord. So L for the lower, or you can say inferior subscapular nerve. And for you can just remember this is the upper or the superior subscapular nerve. And then the N for the nerve to latissimus dorsi, also known as the thoracodorsal nerve. Let it be somewhere thoracodorsal nerve. I'm short of the, okay, let it be guys, thoracodorsal nerve. I will again come to it and I will just show you the muscles. Okay, for A you have to just remember it as the axillary nerve. This is also important because it is going to supply to the uh, like deltoid and teres minor, and also the skin on the lateral side of your arm where the deltoid muscle is. So it is going to give a sensory and a motor nerve. And now the last but not the least, it is the radial nerve. And see why radial nerve is important, because if you have studied the lower limb or the thoracosacral plexus, sorry, the lumbosacral plexus, if you have read about the lumbosacral plexus, you know that there's a nerve also known as the tibial nerve that is going to arise from the anterior part of the thoracal, sorry, lumbosacral plexus. So this is going to somewhat you have to somewhat correlate it with the tibial nerve only, because tibial nerve is going to supply to the posterior compartment of your for the tibial nerve, your leg, and then your knee, and also that is going to form the plantar nerve. And here the radial nerve is going to supply to the posterior muscles of your hand and, sorry, arm, forearm, and also the dorsal aspect of your hand. So you have to somewhat relate it to that. It is one of the important nerve because it is going to supply to a number of muscles. I will tell you after. I will just go and, like, after completing this, I will just show you the muscles where are they located. So now we are going to towards the medial cord. So for medial cord you have to remember the mnemonic m to the power 4th u, or you can write it as m4u. So there are also here 5 branches. See, let me correlate it with something. You see there's a lateral pectoral nerve here, and there's a lateral root of median nerve. So if there's a lateral pectoral nerve, there should be a medial pectoral nerve also. We are going to write it down. And then there is a medial root of median nerve. And then there are 2 sensory nerves, also known as medial cutaneous nerve of the arm. See, when you see the cutaneous word, just remember that it is going to supply as the sensory nerve, and the medial cutaneous nerve of the forearm. And then last but not the least, one of very major nerve we are going to study, that is the ulnar nerve. Let me tell you, this is an important nerve. See, this median nerve and this lateral root and the medial root of median nerve is going to just join together and form the median nerve. So yeah, median nerve is also important. These are the major nerve. So let me tell you something now. See, so there was a question one time. The question was like, which of the following doesn't give off a branch in the brachial plexus? And that is nothing but the division part. I will show you why. Let me make the nerve like this. Okay. So the C5 is going to give a branch known as the dorsal scapular nerve, having the root value as C5 only. And then there is another nerve given by the roots only, that is going to be the long thoracic nerve, also known as the nerve to serratus anterior, or also known as the bell nerve. Then there is going to be another, like, from the trunks you will see there are 2 nerves arising from the superior or the upper trunk. The first one is the suprascapular, and another one is the nerve to subclavius. So I will just write down the muscle. I will just show you the muscles where they are, like, supplying to. Okay, so first let us start with the dorsal scapular nerve. Okay, so let me just show you. Let me just write it somewhere so it would be easy for you. The first one is going to be the let's use some another. Okay, the first one is going to be the dorsal scapular nerve. It is going to supply to the rhomboid major and rhomboid minor. So where are these muscles located? If there is your scapula, let me show you. If I have brought that picture, yeah, there it is. So see, this is your scapula and you are looking it from the posterior view, and this is the rhomboid minor muscle and this is the rhomboid major muscle. So the dorsal scapular nerve is going to supply to these muscles only. Okay, and now we will move again. Where I was in. Okay, so now we will just see the another nerve. There is the long thoracic nerve. The long thoracic nerve, also known as the bell nerve or the nerve to latissimus. The nerve to serratus anterior. So the long thoracic nerve to serratus anterior. I've just okay. So as the name suggests, there is a muscle known as the serratus anterior. I will show you again where it is located. Long thoracic nerve or the bell nerve or the nerve to serratus anterior. Don't confuse it with the thoracodorsal nerve. The thoracodorsal nerve is going to supply to the latissimus dorsi. Say dorsal and dorsi. Okay. So yeah, I will show you the serratus anterior if I have brought it or not. Let me see it first. Okay. So let me see. Yep, I have brought it. Here you can see the serratus anterior, also known as the climber's muscle. Let me tell you, the climber's muscle. Okay, so now we will go again and write some of the nerves. Let's just again go to the diagram. See, this another one is the suprascapular. Okay, suprascapular. It will supply to the supra, means supraspinatus, and the infraspinatus. Supraspinatus and the infraspinatus. Another, let me show you the muscle first. If I have brought it, supraspinatus and the infraspinatus. Yeah, here it is. See, this is the spinous process of the scapula, and the muscle above the spinous process is known as the supraspinatus, and this muscle below the spinous process is known as infraspinatus. Okay, so this muscle is going to be innervated or supplied by the suprascapular nerve. I hope it is clear to you. Let me go again to my diagram. Okay, so another nerve, we will be moving to the medial side. Okay, we are going to the medial side. We have done this dorsal scapular nerve, long thoracic nerve, suprascapular. It's time to the nerve to subclavius. See, it's very like easy. Nerve to subclavius is going to just supply to the subclavius muscle that is beneath your clavicle. I have brought the picture also. Let me show you so you can get a clear perspective of how this muscle work and where are they. So let me see if it is here. Okay, see, this is the subclavius muscle just beneath your clavicle. Let me go again to my diagram, and then we'll be moving forward towards the cord. So let us first finish the lateral cord. So we have the lateral pectoral nerve, lateral pectoral nerve. So let me see. Okay, it's very hectic also to write each and every nerve again. Just okay. Lateral pectoral nerve. This will be supplying to the pectoralis major. Just remember, pectoralis major. Okay, I don't know how you will remember it, but see, you have to just remember, because this will be supplied, like the lateral pectoral nerve is supplied to the pectoralis major, and here you will see the medial pectoral nerve. Okay, let us finish it here only. It will be supplying to the mainly pectoralis minor, and sometime it also supplies to the pectoralis major, partially you can say, but mainly the medial pectoral nerve will supply to the pectoralis minor only, like majorly. And then we will be moving to the musculocutaneous nerve. So let me tell you, musculocutaneous nerve will be supplying to the muscle of your anterior compartment of hand. So what are the muscle of hand? What are the major muscles? You know, biceps brachii. There are three major muscles: coracobrachialis and the brachialis. So there was a question about how the musculocutaneous nerve supplies, like which muscle it pierces. So let me tell you all. It pierces this muscle here, right here, coracobrachialis. It just like it pierces and also supplies to the coracobrachialis, and then it moves to the lateral side of your arm, your arm, and then it ends as the lateral cutaneous nerve of your forearm. It supplies to the lateral part of your forearm as a sensory nerve. So as I told you earlier that I'm not going to discuss about the sensory part, because it is going to be like a very very long video if I'm going to discuss that all. So yeah, so let me tell you all the like I will let me discuss about the median nerve. Okay, median nerve is a very big nerve. Let me write it for like here. Okay, so the lateral median nerve and the median nerve, the median root of the root of median nerve, lateral root of median nerve and the medial root of median nerve will go and form the median nerve. So where is median nerve going to supply? Median nerve will supply to the anterior compartment of your hand. The anterior compartment of your forearm. It won't supply to the muscle in your arm. It is going to supply to the anterior compartment of the forearm. But just remember, it is going to supply to all the flexor muscles except two muscles. All flexor muscle, like the flexor muscles are pronator teres and flexor digitorum superficialis. There are actually two compartments, superficial, deep. You have to remember. Okay, except the major two exceptions are going to be the flexor carpi ulnaris and the flexor digitorum profundus. Flexor carpi ulnaris and the medial part, medial half is going to be supplied by these two. The medial half of the flexor digitorum profundus and flexor carpi ulnaris is going to be supplied by the ulnar nerve only, and then the median nerve moves laterally towards your hand and it is going to supply to the thenar group of muscle except adductor pollicis, and then also the except let me write it somewhere else. I don't think it is that important, but yeah, adductor pollicis, and then the another muscle is going to be the lumbricals. See, just open your hand and see that the like median nerve is going to pass like through your radial, like where your radius bone is located, and it will go all the way toward the thenar muscle on your lower part of your thumb, and it will go and supply to the two lumbricals, the first and the second, L1 and L2. These are two lumbricals. So these thenar group of muscle, lumbricals, anterior compartment of forearm, that is all flexor muscles, are going to be supplied by the median nerve only. And just remember this exception. Somehow I don't know how will you remember, but I remember adductor pollicis is going to be supplied by the actually the radial nerve only. Okay, so I don't think that is important. It is that important, but okay, it will be important when you will discuss the clinical cases of it. So let me write it now somewhere else. So we have already done the medial, lateral, and the musculocutaneous nerve. Now we will move to the sub lower and let me write it here, it's easy. These two nerves, lower inferior, lower and upper subscapular nerve, are going to supply to the subscapularis only, that is located somewhere here, subscapular, the anterior region of your scapula. If let me see if you can see it all. See, this is the scapula, okay. So in the back side you have seen there is supraspinatus and infraspinatus, but in the anterior region, this there is the subscapularis muscle. I don't have the picture here, but yeah, just imagine it somehow. Okay, so we will go and move forward and write it down. It will supply to the subscapularis nerve to latissimus dorsi, will supply to the latissimus dorsi. Let me show you all. Where is latissimus dorsi again? I've already showed you. There's been a slight mistake here. The serratus anterior is not known as the climber muscle, it is known as the boxer muscle, boxer's muscle. See, the thing about anatomy is like you keep forgetting it, like me. Okay, so the latissimus dorsi, if I brought it, let me see. Yep, there it is, the latissimus dorsi muscle. This muscle here is supplied by the thoracodorsal nerve or the nerve to the latissimus dorsi, also known as the climber muscle. I've been trying to put all these in a single video. Actually, the nerve topic is something that requires efforts. Okay, let me see. Okay, let's move forward. Okay, now there comes the axillary nerve. This will supply to the deltoid muscle and the teres minor muscle. The radial nerve, this nerve here, have I told you earlier or not? But the radial nerve is going to supply the posterior compartment of your hand. Sorry, let me write it from sequence. The R, that is your triceps brachii muscle. Forearm, that is all your extensor muscle, and also your sensory part of your hand, the dorsal part, dorsal skin, you can say. Okay, so that is about the radial nerve. I've told you already about the pectoral nerve. I've told you already about the medial nerve. The medial cutaneous nerve of the arm is going to supply to the cutaneous part of your arm, the medial cutaneous, like lower 1/3 part of your arm, and that is that the another one, medial cutaneous nerve of the forearm, is going to supply to the forearm only, the cutaneous, the skin part of your forearm, that also the medial. And last but not the least, there's the ulnar nerve. Ulnar nerve, that is going to supply to the muscles. Like there are two muscles I have already told you. That is the flexor anterior compartment only, anterior compartment muscle of your forearm. Those two muscles, flexor carpi ulnaris. See, the ulnar part of your forearm is, and also your hand is like supplied by two nerves, the median and the ulnar nerve. They both like supply to your anterior part, and also the flexor digitorum profundus. Okay, let's move forward. And also all your intrinsic muscles of your hand, except the three thenar muscle and the two lateral lumbricals, as I have told you earlier. Which head of the flexor digitorum profundus? The medial head. Let it write is intrinsic muscle of your hand. So why not just we make pictures? See, the biceps brachii and the biceps brachii, the brachialis and the coracobrachialis. These all are supplied by the musculocutaneous nerve, as I've already told you. The latissimus dorsi is supplied by the thoracodorsal nerve, also known as the nerve tooth latissimus dorsi. From the, you see, lunar, we had the mnemonic from the N, the posterior cord. Okay. See, I have a picture here. This part is supplied by the median nerve. Median nerve comes from here and like it gives here, gives branches here, and except all muscle except the adductor pollicis, and the ulnar nerves like come from here and supply to all the hypothenar muscles. Okay, and let me see if I have brought anything more. See, pectoralis major muscle is supplied by the lateral pectoral nerve. The pectoralis minor is supplied by the medial pectoral nerve. And we will move forward. See, this is not a very good diagram, but yeah, all of this flexor, palmaris longus, these all muscles except the flexor carpi ulnaris is, this is flexor carpi ulnaris muscle. This is supplied by the ulnar nerve, but all other flexor muscles are going to be supplied by the median nerve only. Extensor muscle, the brachioradialis extensor, all other nerves are going to supply. The muscles on the posterior compartment of your hand is going to be supplied by the radial nerve only. The biceps brachii, as I've already told you, musculocutaneous nerve. We'll move forward. Rhomboid major, rhomboid minor. I told you from the roots there's a nerve known as the dorsoscapular nerve. That is going to supply the rhomboid major and rhomboid minor. Subclavius, the nerve to subclavius only. This is the pectoralis minor, the medial nerve of medial pectoral nerve. Now to subclavius. I hope this is something you should be clear about. I told you already the three cords are going to like this. There you can see there is the axillary artery. So the cord passing lateral to it is known as the lateral cord. The second part of axillary artery, the cord passing medial to it is known as the medial cord, and the cord passing posterior to it, as you can see, is known as the posterior cord. So that would be all from my side for today. Thank you and have a good day.